Hey, this is Dr. Bruce Blakely in San Diego, your auto accident expert clinic. A question I hear a lot from patients is, can neck injuries occur in a slow impact or a non-forceful rear end collision? And of course the answer is yes. And to fully understand this concept, think of plastic versus elastic, and we call it a deformity. Now, in a plastic injury, you're going to a lot of crumpling, the plastic, the bumper, the fenders are going to crunch, the trim may fly off the car, so the car's absorbing a lot of that impact. Now, elastic deformity occurs at a slower speed, but is nonetheless can be just as damaging to the spine, or the occupants, meaning the passenger or the driver, the backseat passengers, are observing more of the impact itself versus the plastic part which flies off the car, okay? Now, to be sure, other factors are involved in this. By that I mean, did you get hit by a semi-truck? How fast was the car going? What kind of car are you driving? Are there airbags and the seat belts? But there are those other factors involved do account for the type of injury that you have, okay? So, now, kind of recapping it, accidents happen real time. A lot of them are fast, boom, causing those plastic deformity injuries. Now, happening real time like that, you usually have time to react and to brace yourself. But if you find yourself in a slow moving, where a slow injury is going to occur, brace yourself and try to look straight ahead. That way your head's not going to move around the most. Most injuries occur when your head is turned, you get hit hard. The neck only goes so far, and at that point it starts to stretch and tear, okay? So if you have injuries from an auto accident, you need to be seen at our clinic. We do specialize in personal injury. You can come and see us, okay? And most of our research support indicates chiropractic care is effective and appropriate for treatment. So if you have any injuries and you need to come and see in our office, we'd love to see you. Blakely Chiropractic, 619-281-1999. Thank you very much.